My name is Staff Sergeant Stephen Still from the Defence Medical Academy. In this lesson we're going to go through clinical observations. By the end of this lesson you'll be able to define respiratory rate, pulse rate, blood pressure, oxygen saturations, which is SpO2, temperature and pain score. You will also be able to demonstrate taking these observations. Temperature is measured by a clinical thermometer. The normal bodily temperature range is anywhere between 35.8 and 37.8 degrees Celsius. There are three methods: oral, groin or axilla, and rectal. The temperatures in red are the average temperatures you would expect from those areas. Whichever area you take a temperature from, you should always take it until the thermometer beeps or 5 minutes has elapsed. Patients not to have their temperature taken orally include small children and babies, unconscious patients, patients with mouth injuries, epileptic patients, hysterical patients, mentally ill patients. Pulse. A normal adult pulse rate is anywhere between 60 and 80 beats per minute. Abnormal pulse rates are over 100 and below 60 beats per minute. You take this for a full minute. And you take this at the base of the thumb on the wrist and you measure for 1 minute. A good tip for you as we move on to respiratory rate is you can take that for 1 minute, keep your finger there and then take the respiratory rate. Because patients, if you tell them that you're taking their respiratory rate, they will actively and knowingly change their breathing pattern. You won't get an accurate respiratory rate. So take the pulse for 1 minute, move on to a respiratory rate, take that for 1 minute. Respiratory rate. Normal respiration rate of a healthy adult at rest is between 10 and 20 respirations a minute. The respiratory rate must be taken for a full minute. And above 20 or below 10 are abnormal respiratory rates. Blood pressure is the measurement of force applied to the artery walls. Normal blood pressure of a healthy adult at rest is 120 and 80. This is recorded in documents as a fraction, 120 over 80. This is a link to a manual blood pressure video. Pulse oximeter. This measures the oxygen saturation levels in the blood. It's a device that measures the amount of haemoglobin saturation in tissue capillaries. Factors which may impact on pulse oximetry reading are nail polish, movement, recording blood pressure and cold hands. There are a number of devices which you may encounter in your time in the hospital. They range from a small device which sits over the end of a finger, so that would impact on if they're wearing nail polish, you might not get an accurate reading on that. You can also get handheld devices which have the same probe on the end, just clicks over there and you hold it. You can also on these get a band, elastic band which wraps around the finger. And you can get full monitors which take a number of observations at the same time and you will just read off there what the SpO2 level is. Pain score. There are two main types of pain score that you may come across, 0 to 3 and 0 to 10. I would urge you to avoid using 0 to 10. Okay? If you use 0 to 10, it can give too much variation for a patient. If you use 0 to 3, it's a lot easier to narrow down at what level their pain score is. 0 being no pain, 1 being mild, 2 being moderate, and 3 being severe. Considerations. Regardless of which clinical observation performed, you should always consider the patient's dignity, privacy, and beliefs. So in summary, you can now define the respiratory rate, the pulse rate, the blood pressure, oxygen saturations, temperature and a pain score, and you can demonstrate taking the above observations. This is a reference for further reading.